plastic surgeon extraordinaire, and I will be answering questions that have been asked of me, and I will also be answering any questions that anyone has. If they want to ask me a question, they are more than welcome to do so. So I've just been out trying to unblock the drains, so all mud in them. I don't know why they don't invent something to stop all the leaves and the mud falling down, but we are where we are. So can't tell you much about unblocking drains because I've been wholly unsuccessful, and trying to do it from the ground up. Probably need to get a man, because I tell you what, I've tried to go up on the ladder and I cannot do that. That is absolutely terrifying. Even going close to the top. How those people put those Christmas lights on their roofs, I don't know. I guess they get professional people to put them in. Surely not a normal member of the public can get Christmas lights under the eaves of their house. They can't get that high with a ladder. I mean, I've got a ladder that goes up, well, not quite that high, but to get 3/4 up. Oh, dear, oh dear. Anyway, so what we got? We have got a question here. Do we offer breast implants called Motiva Ergonomix? Answer to that question is yes, we do. I'm not really tied to any company or a manufacturer, so I can use any make as long as the hospitals can get them. And certainly Motiva, I know, is one that the hospital can get. So Motiva is the company. Ergonomix is the sort of type. So Motiva are micro textured implants, so they're not as rough as the original ones, which are a bit more rough. The roughness makes them less likely to go hard, but the roughness also increases the risk of capsular contracture, which is why the less rough implants are around. So there's good and bad about them. Another thing is that the less roughness of it is, by the way, I'm assuming everything's working in terms of audio. The less roughness of it means it's less adherent to the pocket. Therefore, you don't get teardrop shaped, smooth or micro textured implants because they don't adhere. So a teardrop one would move about all over the place. Therefore, Motiva make this ergonomic. So they make two types. They make, I think the other type, I think it's called round, the other type. I think that's right. Anyway, I might be wrong. But anyway, they basically make two types. And one is a bit less, the gel is a bit less cohesive. So it's a bit more runny, so that when you're in an upright position, my arms are all wet because I've been doing the drains and actually quite filthy. But anyway, there you go. So when you are in an upright position, they go a bit more teardroppy in shape, and that is the Ergonomix one. So the Ergonomix implant is a round implant, but it is not as round as a Motiva round implant because the gel is a bit more sort of watery, if you like. So it takes a bit more of a teardrop position in the body. Some surgeons don't use teardrop implants at all. They think that all implants do that to a degree, and I think they probably do all do it to a degree. But the more cohesive the gel, the firmer the gel, the less it's going to do that. So if you want a fuller look in the upper part, you'd probably want a round one. If you want a more natural look with less fullness, then you'd want a teardrop or a less cohesive gel like this Motiva Ergonomix. But anyway, the answer to the question is yes, we do offer them because that's they're a sort of normal company that can be bought in the hospitals can get. So as long as the hospitals can get it, I'm not tied to any particular make. So can you offer tattoo excision for a tattoo located on my finger? Now, the overriding thing about tattoo excision is I'd say I can take off a tattoo any part of the body. I'll say I don't want to make it out as if it's just me. We, plastic surgeons, can take out a tattoo off any part of the body, but it depends on the size of the tattoo and the amount of laxity in the area of the body that it's in. And the finger has not got much laxity at all. So I'm not going to say no, but I'm going to say probably not, because in my experience, most finger tattoos, although they look small, there is not enough skin to cut them out and stitch them up. And I wouldn't like to do a skin graft on the finger, because if the graft adheres to tendons and means you can't move your hands very well, it's just not a good thing. So I wouldn't do a skin graft. I would do a direct closure, and there just isn't enough laxity on the finger as a rule. Never say never. Long thin ones are better than round ones. So never say never. But and also people say, look, I've got loads of laxity on my skin, and then you've got to make a fist, and all the laxity goes because it's sort of, you've got to be able to make a fist. So fingers, really bad place for tattoos, basically. So probably not, but always happy to have a look. So send us a email, send us a photo. I'll have a look, and we'll say, look, whether it's a goer or not. Oh, this is a longer question. Put it on. So this one is: I've lost 5 stone, and I'm interested in having a tummy tuck with you next year once I've kept a stable weight for a good period of time. I'm happy with. For a good period of time, I'm happy with. I have done lots of research, but you hear of people having drains afterwards and some not. What are the pros and cons, and what do you do? So, done a blog post on this ages ago now. So, but anyway, pros and cons, absolutely right way to frame that question. You've got to be a bit careful about someone who tries to tell you that one is better than the other. So, pros and cons of using drains. Well, the pros of using drains are that they are suction drains, so they continue, so they suck down the skin flaps. So when you do a tummy tuck, there's a space that goes up to your rib cage. You make a space up to your rib cage in order to loosen the skin and bring it down, particularly centrally. You make a sort of tunnel centrally, and then you can repair the muscles there. But that space can fill up with blood or can fill up with fluid. Blood meaning a hematoma, fluid being a seroma. And that can be a nuisance. A hematoma, you have to go back to theatre. A seroma is something that happens sort of days and weeks after the surgery, which is like watery fluid collecting in the space. And again, that can be a nuisance. And by putting in drains, suction drains, it helps those two tissue planes to stick together. So what do? I use drains because I think they're good at sticking that together. Now, having said that, there are ways you can get it to stick together without using drains. They used to, a while ago, they used to do quite a lot of the glue. You can spray glue in the space and hold it there for it to stick. I never particularly like that because I always thought it might shear, like if you glue a cup and you like suddenly knock it when the glue's not firm, it's not going to stick back again, is it? So that always worried me. So I wasn't a big, and also it's quite difficult to do the surgery when you're using glue because you have to sort of stitch it up while you're holding the glue because you've got to use, people use locking sutures and stuff like that to hold it while you're stitching, and it's a bit difficult. So I don't, I'd rather take my time at getting it all aligned and everything. So, and the other thing you can do to close down the space is use quilting stitches. And I do use quilting stitches. So that instead of having one big space, you have lots of little spaces because you put lots of deep stitches to close that space down. And so I know people are saying quilting stitches you can use and not use drains. Now I use quilting stitches and drains, but there's no right or wrong. So that's the reason I use drains. So what are the cons of using drains? Well, the cons of using drains are, main con is that it is uncomfortable to have them removed. Patients don't like them to have it removed. It keeps you in hospital. Now, I pretty much only keep my drains in overnight. So it only keeps you in hospital one night, and you might want to stay in hospital one night anyway for an operation like a tummy tuck. So I don't think that's a massive con, the fact that it keeps you in hospital overnight, but it is a bit of a con that it's uncomfortable. That is a con, as in a bad thing, not a con like, we're not conning you. It's like a opposite of pro. And the other thing is, which I have had happen to me, and one of the reasons I stopped using them, so I've stopped using a lot of breast surgery and gynecomastia. I had a case where I was doing gynecomastia and I put the drain in, and the chap got a hematoma. He got a hematoma from the place where I put the drain in. The drain's like this big spike, and you have to put the spike through the skin, and that had caught a blood vessel, and it actually caught the drain and actually caused the hematoma. I mean, that's a sample size of one, but that is a bit of a con. There is a potential when you put the drain in, you can actually nick a blood vessel and actually cause it to bleed. But the main reason is the uncomfortableness, I think, of having it removed. So that's why I think people don't like them, and we are moving them away from them for a lot of plastic surgery. But as I say, I do use them for tummy tucks, although I'm doing quilting, and things might change. Cat, what you got? Cat's got a question. What's the cause of a late seroma? Say 6 months post-op, and what's classed as a large seroma, a small one, etc.? Two-part question. Very good. Cause of a late seroma. Usually, it would be something. It might be that if you have a quilting stitch, that quilting stitch might go. It might be that you have some kind of non-specific illness, some non-specific viral illness. I'm thinking more about the breast here in terms of late seromas. Sometimes you can get a late seroma in a breast implant, like I wouldn't say six. I mean, this can be years post-op. So 6 months post-op. Not sure if that would be still a late seroma, but you know, certainly years post-op, you can get seromas. Very rare, more common in the breast because that is a foreign body, which is sort of potentially irritating to the tissues. A seroma 6 months post-op with a tummy tuck. I mean, that's probably just a seroma, I guess. I don't know. I mean, unless it was like totally no sign of it, because there's all sorts of swelling and stuff in the first few months. And it might be that once the swelling goes down, you think, hold on a minute, what's going on here? I've got a seroma. I don't know. But yeah, could be if you have got quilting stitches, maybe a little stitch has gone and made a bit of a space, or maybe you've got some kind of non-specific viral illness or something that's caused some inflammation in your body, which can cause it. Or maybe you've, you know, done the gym or something and pulled something. Having said that, at 6 months, I would say to you, you can do whatever you want in the gym, but maybe some activity or something might have made something go and cause a bit of space. A large seroma and a small one, there's no real classification of that, Cat. It's just what you want to call it. Those are just words. There's nothing medical about what's large and what's small. It's like, what's the definition of a minor op? One that's not happening to you. It's all relative. Any op having to you is a major op. So any seroma for you is probably a large one, isn't it? But there's no medical distinction between a large and a small. The quilting, is that when they refer to loculated in pockets? Yeah. So the quilting is exactly that. So you make it into pockets like a duvet. You know, the duvet. So all the stuffing of the duvet doesn't. You remember it used to all go to one. Go to the end, and now they put like a bit like a Chesterfield sofa, like the buttons. So we put quilts to make smaller spaces. Quilting makes smaller spaces. Now loculated is more of a term that you would use for an established seroma. So slightly different thing. So quilting is a thing that you do at the time of the surgery. You put these dissolvable sutures to make smaller pockets, so you're unlikely to get some big seroma ballooning up. It'll be contained in smaller pockets. A loculated is more what you describe an established seroma. So sometimes an established seroma can have septi, can have partitions. So it's a big area of fluid, but there can be partitions within that fluid. So when you put a needle in and drain it, you might just get one of those spaces, one of those locules. That's a loculated seroma. So it doesn't completely drain. Basically, you put your needle in and you drain it, and there's still stuff there because it's got these partitions. If that's a real problem, you can do it under ultrasound guidance to try and make sure you get all the loculations. So loculated is what a partitioned up seroma is, by partitions of the loculations of the seroma, whereas quilting is partitioning the space so you don't get a seroma, or at least you get smaller seromas. Not so much of a problem. Abdominal seroma, would it be late? I wouldn't say 6 months. Would it? I mean, it is a bit late, isn't it? 6 months, you do expect to be out of the woods. Depends on what you've been until now. I mean, if you've had no problems whatsoever and it was washboard, and then at 6 months it balloons up, well then yeah. But you know, usually in the first few months after a tummy tuck, it's not quite right, and there's swellings and all sorts. So you know, not that late. I mean, as I say, you can get them years later, although that would normally be a breast would be years later. I know they differ on patient BMI, etc. Yeah, I mean, all your complications are higher, really, a higher BMI, Cat. So yeah, BMI is a thing for everything: wound healing, DVTs, all sorts of problems, higher BMIs. I've had my US ultrasound and got a collection that's at least 11.8 by 8.4 by 3.2. I had a swishy belly early on, but that settled. Yeah. Well, there you go. I mean, a lot of this, Cat, is I mean, I think plastic surgeons, maybe all surgeons, trying to make things difficult by giving things words and loculation and you know, quilting and all that sort of stuff. But basically, it's just fluid in the space, and it doesn't late, early, large, small, loculated web. It doesn't matter what it's called, does it? You know, you've got fluid there. Question is it annoying? If it's not annoying, if you put up with it, wear your binder, see how it goes, should get better. If it is annoying, you can put a needle in and drain it off. It's usually, you know, a doable thing in the clinic. It's not usually a big thing to have it drained. I don't know if you've had a problem, but usually it's a clinic procedure that you put a needle in. It's a bit of a nuisance and it can be hard sometimes if it's loculated, etc. But it's, you know, it's something that can often be dealt with in the clinic. And if you've had an ultrasound, sometimes they can do it at the ultrasound. But yeah, I hope you're not having too much problems with it, Kat. But it can be a nuisance. That's why I use drains, Kat, because I don't like seromas. Very rarely get seromas because I do use drains. Although, you know, there is a downside with drains, as I said. But yeah. Right, what we've got here, we've got another big long one. I had a cyst on my forehead just below my hairline. It has popped this week and a lot of fluid has come out it, but I can feel the sac under the skin. I'm worried if it will get infected now as there's a hole in the outer layer. What should I do? Yeah, I wouldn't worry too much about the hole in the outer layer and the hole in the skin. Most cysts, most sebaceous cysts, have a connection with the outside world called a punctum anyway. Now, you often can't see that punctum. Sometimes you can see that punctum, but they often have a connection with the outside world anyway. So the fact that it's popped and you've got a connection with the outside world, won't worry too much. Now, if it's obviously a big wound, then there is a risk of infection. But we say on your forehead, yeah. So the face has got a good blood supply, so it's not as common to get infections on the face. But I mean, you could get an infection, but the point is, I wouldn't worry about it. I mean, obviously keep the wound clean. I don't know what sort of work you do, but avoid sort of dusty, dirty environments while you have got that sort of, if there is an obvious opening. But the thing to do when it pops is just do nothing really. Let it settle. Obviously, if they are uncomfortable and things, once it's popped, they can be a bit more uncomfortable. So it can be quite a good thing when it's popped. You know, I won't worry too much about infection. I'm not saying it won't get infected. Of course it could, but, you know, that there's not a lot you can do to prevent that. But you're absolutely right. There will still be a sac underneath the skin. And so that will need to be removed. Well, I say it will need to be removed. It might have popped and you might have no problems with it, and that'll be the end of it, in which case that's it. But it might come back again. When a cyst pops, it can come back again because the cyst wall does remain. So, you know, don't be surprised if it comes back again. And if it comes back again, then you might want to have it removed. But we really remove them once it's all settled and it's all quiet, and then we can remove the cyst wall. We can't really remove the cyst wall now that it's popped because it's like an empty bag and you can't really get a handle on where the cyst wall is. So you have to kind of wait for it to refill and the cyst to reconstitute itself, and then you can remove it. But don't worry, is the bottom line. You know, it's popped. Don't worry, see what happens. I don't know whether I need a breast reduction or a breast lift. What would be your advice? Well, this is an easy one. Very simple. What size are you? Are you happy with that? Do you want to be smaller? So a breast reduction and a breast lift are essentially the same operation. The difference being that a breast reduction, some tissue is removed, and so the size is reduced. With a breast lift, it's only skin that's removed, so your cup size doesn't change. Only a very small amount of volume is removed because it's just the skin, and then we just rearrange the tissue that you've got, the volume of breast that you've got. You rearrange that higher on your breast to a better place, and keep you about the same size. A reduction is a similar skin excision and tightening the skin and lifting the breast, but at the same time some tissue is taken out, usually from the lower pole of the breast and often laterally on the sides, to make the breast smaller, to make it less heavy, to make the cup size smaller if you want to be a smaller cup. So if you're happy with your cup size, it's a lift. The only thing I would say that if you have got a big breast, if you've got a lot of breast tissue and you have a lift without having a reduction, the volume of the breast tissue will be acted on by gravity, so it could droop again. So you would get a longer lasting result with a reduction by taking some volume out of the breast. But obviously you'd have to be happy having a smaller breast. If you don't want a smaller breast, just have a lift. If you're not bothered, having a bit of a reduction, at least take some volume out of the lower pole, will give you a longer lasting result. But obviously you've got to have what you are happy with in terms of the size. So that's the question. If you're happy with the size, just have a lift. If you're not happy with the size, you want them smaller, have a reduction. What you got, Paula? I got a BL. BL, is that breast lift? Okay, I'm going to go with breast lift. I got a BL 2 years ago, and he'd done the nipples too high and one slightly too right. Can this be corrected, and is it risky? I'm not going to say that the worst thing you can do, Paula, is to put the nipples too high, but it's a pretty bad thing to do, to put the nipples too high. Not a bad thing to do. I mean, it's a pretty bad thing to have done to it. The symmetry of the breast looks wrong. Putting the nipples too low just makes them look a bit droopy. Putting them too high looks a bit odd, particularly if they are peaking above your bra. So that is a problem. The one that's too right isn't too bad. The first thing I would say, Paula, is it's difficult moving nipples. It's difficult moving nipples. Now, it's kind of easy moving nipples up, actually. You can move them up. That's relatively easy. Moving them down, the problem with moving them down is that if you have to move the nipple down, then you would worry about leaving a scar where the nipple was. So moving them up doesn't matter, because you leave a scar where the nipple was, which was lower than the nipple. So you don't mind having a scar below your nipple, but you don't really want to have a scar above your nipple. So that's the worry about moving them down if you leave the scar above. Now, sometimes the fact of the matter is the breast can bottom out. I don't know if you've heard of that. So there's too much tissue below the nipple. So it's not actually the nipple's too high. It's that there's too much tissue below the nipple. So it can make the nipple look like it's too high. It looks like it's pointing up. And so that might be possible to actually shorten the distance from the nipple to your crease to sort of tighten that and bring it back up again. And that might be possible to make this geometry of your breast look better without actually lowering your nipple. So you don't actually, the nipple's actually not too high. It just looks too high. I don't know if that's being made sense there. But that's something you need an examination really to just see where the nipple is. And if it is genuinely too high, then yes, I wouldn't say it's risky. It's just difficult because you might have a scar where the nipple was. That's the problem. The problem with having it moving it from the right, so moving it side to side, again, it can be done. There's a limit to how far you can move it, but also what you do when you move it side to side is you take a crescent of skin. So if it's too far to the right, I don't know which one it is. So let's just say your right nipple is too far to the right. So it's too far lateral, too far to the side. Then you take a crescent of skin medially, and then you bring it across. But that runs the risk of making the nipple look elongated again, because you don't really want to leave a straight line scar where the nipple was. You're okay moving a straight line scar down, but you don't really want to have a straight line scar to the side or to the top, so you can get an elongated nipple when you move it laterally, move it from the side to side. So it's difficult. Rather than risky, I would say it's difficult. It's not so much risky because you are probably not talking about moving it very far. It is risky moving nipples. You can alter the blood supply and the nerve supply and things, but I'm guessing we're talking centimeters here or fractions of centimeters. So I'm guessing it's just trying to get the balance right. And often just if the balance is a little bit off, it doesn't look quite right. And having it too high is not good. And it's a bit annoying when that happens because the geometry of the breast doesn't look quite right. So it's difficult is the answer, Paula. I haven't got any simple answers. The worry is leaving a scar where the nipple was, whether it be above or to the right of the nipple. It's a tricky one, Paula. It's a tricky one. Breast lift. Yeah, it was breast lift. I got that right then. Chantal, what have you got for me? How long after a tummy tuck would you recommend a tattoo? I was bodged abroad. Oh God. I was bodged abroad to have a massive front scar. It's been close for about 3 months. Yeah, I would say 3 months sounds reasonable, Chantal. Yeah, I mean, it depends on how the scar looks. I mean, if it looks red and active and is still a bit uncomfortable and it's quite thick, then maybe leave it. But 3 months sounds very reasonable. I would say 3 months is what I would have said. And again, it's different. Sometimes people have really good scars at 6 weeks. Some people have really red active scars at 6 months. So it depends on how it looks. So if it's settling and if it's not too red and active, then I would say 3 months sounds reasonable to me. But you have to check with your tattoo person, because a tattoo person might have and well, as I say, Chantal, I always say on this stuff, check with your surgeon really. But anyway, yeah, I had a 360 FDL. 360 FDL, 360 fleur de lis. So they went all the way around and fleur de lis. Okay, wow. It's a big op, Chantal. It's a big op. It does. Thank you so much. I think it could have been too much tissue below. This info is valuable to me. To be honest with you, Paula, if it is too much tissue below, then that's actually quite good, because if you can just shorten that distance from the nipple to the inframammary fold and shorten that vertical scar, then you can actually keep the nipple where it is, and it doesn't look so high anymore. So that would be a good thing to do. The worry is it stretches again and stuff like that, but at least it's better than trying to actually physically move the nipple itself. Kind of you to say that, Paula. Chantal, this, thank you. It's white but red on the outside. Yeah, white's good. Yeah, 3 might be all right. It was a massive open wound for 4 months. It took 8 months to close. The lumps have gone now. They want me to go back to reoperate. I said no. I own a tattoo studio. I was going to say, ask the tattoo person. I said no. I own a tattoo studio. Just not sure on scars. 360 is all the way around and straight down. 5 kilograms skin removed. Yeah. I wouldn't do a 360 fleur de lis. I would do a fleur de lis or a 360. So you've had a 360 and fleur de lis, but who knows? So there's lots of ways to do things, but that's a nightmare. It can be, yeah. Big op though. A 360 is a big op, Chantal, and a 360 fleur de lis. I mean, that's just going to have a high risk of having problems. Yeah. If don't worry about the scars, Chantal. If they're feeling okay, they're not too uncomfortable, color's faded, I would say you'd be okay at 3 months. I mean, it's ideal if it's all white. The red on the outside may be a bit, I don't know, but yeah. Look at this. This is into Facebook support. Chantal, hope you're okay now and all is healed and you're strong mentally. I know, takes you back stuff. This stuff mentally does. Wound for 4 months when you're having a big op like that, which is going to be a life changer and all that. That's quite a difficult one to deal with, I'm sure. So I'm sorry you've gone through that, Chantal, but hopefully you'll get yourself a nice tattoo to cover it up. Do we offer local anaesthetic for a mini tummy tuck and breast augmentation? I mean, my answer to that is probably no. I wouldn't do it. Can it be done? I don't know. Probably can be done. Yeah. In fact, yeah, I'm sure. No, I don't know. I wouldn't do it. I mean, the places I work can do local and GA, and so I would say for a mini tummy-tuck and breast augmentation, 2 areas, it's going to be quite a lot of anaesthetic. I would go with a general, unless there was some very good specific reason you didn't want a general. I just think it'd be perhaps easier, maybe safer, to do a general now. But I don't do a lot under local installation. So some people do loads under local installation and will probably say, yeah, so walk in the park, do that before breakfast. So it might be fine, but I'm saying that's on the upper end for me. Just because it's sort of 2 areas, quite a long anaesthetic. I think it's quite a lot to have under local anaesthetic. So when you say local anaesthetic, you mean local installation. You wouldn't have under pure local anaesthetic, it'd be local installation. And I'd say that's quite a lot to have under local installation in my hands. And I would be inclined to go and recommend that you have a general for that. Whether it could be done, probably the answer is yes, it probably could be done. Mini tummy tuck and breast augmentation. Chantal, thank you. Much better, lovely, back at work. Just need a tattoo, no to hide it. Absolutely, yeah. Can we remove blue pigment moles? Yes, we can. So blue pigment moles, also known as blue nevi, nevi just being a fancy word for mold, is basically just a mole, or at least the pigment cells are quite deep in the skin. But yeah, they're just quite deep in the dermis. But you can remove them. You remove the whole thickness of the skin when you remove a mold. So absolutely, the answer is yes, because when you remove a mole, you cut out the full thickness of the skin. So yeah, blue pigment mole or blue nevus, absolutely fine to remove. No problem with that. The cyclospor is a hard bit. You have to be positive to remind the post-op bits. A few weeks on, the hardest, absolutely. Absolutely. That's why I always say to people, like, sometimes you get people who are like going through a divorce or moving house or having some major life event, and they're saying, this is my time now. I'm going to have my tummy tuck or whatever. I'm going to have my surgery. I always say, look, I wouldn't have it at that time because it doesn't always go right and you can get problems. Now, in the future, in a year's time, you'll probably look back and think, oh, it's great. I'm very happy with everything. But in the first few months, you can get issues, seromas, wound breakdowns, goodness knows what. And so if you're going through a psychologically difficult time already, you're going to think, oh my God, everything's going wrong. I'm having a divorce and now my tummy's not right and his breasts aren't right or whatever. So it is a psychologically as well as physically demanding thing to do to yourself. So you have to be like stable basically before you have it, because it can be difficult. The post-op period can be difficult. There is often stuff that doesn't look like you want it to look like, and it usually will look fine at 6 or 12 months, but you have to get through that first 3, 6, 8 months, which is difficult, and which is why you need to stick with your surgeon, get reassurance, get things treated and stuff like that. But yeah, Chantal, our scars are hard to deal with as we all heal very differently. We know it's a trade-off and can't be avoided accepting them. Yeah, and everyone's different. Everyone's different in how they scar as well. Some people scar really well. Some people scar a bit more obviously. But usually, you have to give it a good year or so for it to properly settle. So I'm sure things will improve even more over time, Chantal. I'm sure of that. Right, nice bit of interaction, Chantal Cat there. Well done, you two. And got to be honest, Instagram's been a bit quiet. Sometimes Instagram kicks off, sometimes Facebook. Who knows what's going to happen? Anyway, I'll take it where I can get it, to be honest with you. But thanks for being here. I am now going to go and sort things out because I haven't sorted anything out, to be honest. I think I was supposed to do dinner and I haven't done it. And my wife's just got home and I'm probably going to be in trouble. But, I've been doing the drains. So, what can you say? Anyway, I will be back next week. Will I? Is next week normal? Yes, it is, isn't it? Monday we got your bank holiday then. Oh, actually, next week I'm in. Oh, I don't know if I'll be doing it next week because I'm in Liverpool. I don't know. Got a big op next week. May or may not be here next week. Definitely the week after. I have to see how next week goes. Next week is there's lots going on next week. Oh God. Anyway, but anyway, I'll see you soon next week or the week after, and have a lovely evening. And thanks for joining and thanks for participating and viewing. I will catch up with you 7 p.m. Tuesday night.